This course is going to review coding for medical office visits in our office. The Evaluation and Management Codes, or E&M codes, are codes that start with a 99, and thorough documentation is necessary, and there's three main components: the history, examination, and the decision-making that allow us to code at the various different levels. So here's an example of a new patient, a 9920, indicating that it is a new with the 0. So a 99201 is going to have a problem-focused, whereas a 205 is going to have a comprehensive history and exam, and then the decision-making is going to be indicative of the straightforward or high complexity. The difference between a 201 and a 211 is a little bit different. When we do a 201, we only have to fulfill we have to fulfill all three of these. When we do a established patient, we have to fulfill 2 of the 3 in order to bill at that level. 4 parts to the history: chief complaint, history of present illness, past family and or social history, and review of systems. There's essentially 2 levels, 8 total areas. There's extended or brief, and that is broken up into 4 or more areas as extended, whether you're asking questions such as which eye, what caused it, did the problem occur, is it worse at the distance. So if you ask less than 4 areas, then it's going to be brief. If it's more than 4 areas, then it's extended on this particular component. Now, the next 2 are the past family social history. There's 2 levels: complete, asking 2 or more, or pertinent, being 1. Review of systems, which is a relatively lengthy discussion of the systems of the patient's body, their cardiovascular system, their GI system, etc. So here's the list of the different things for review of systems. You note that eyes is in there. That's convenient for us since we always ask people about their eyes. So we're always at least at the problem pertinent, but if we ask any beyond that, then we get into the extended component. So here's the problem-focused, history of present illness, expended problem-focused, detailed, and comprehensive. When it comes to a history, you can break it down into these components. The examination can be broken up into 4 components, from problem-focused down to comprehensive, and it's based upon the number of examinations that you do for the patient. There's a lot of elements that go into this. So here's the basically 14 elements that go into examination, and when we see a patient, we pretty much are doing 8 or 9 of these on almost every patient. We always do VAs. We usually will do extraocular muscles. When we do a slit lamp, we're checking for the conjunctiva. We're looking at the cornea, the anterior segment, the lens. We almost always check pressures on our patients, and we're always checking the mental status and the mood and affect for the patient. Decision making is something that the doctor is going to do, and it can range from straightforward to high complexity depending on the number of potential diagnoses or the complications that are going into it. So breaking it back down here, this is a new patient, whether it's a 99201 or 205, will based upon how complex the history, how complex the exam, and how complex the decision making is done. And then here is the established. In most cases, our established patients, we are able to do a 214. Sometimes we don't get enough and we end up doing a 203. For new patients, the vast majority of people either fit into a 203 or a 202. For more details that may be less complex, go to the Billing and Coding 101 video, which will be a little bit more brief, less complicated video.